So what have you been up to this weekend? Anything fun?
This weekend, actually, I just had a quick trip to New York. So flew up on Friday, spent part of the day, and then flew back on Saturday.
I want to get into this. You travel so much, but most people, when they think about travel, they think about, okay, I'm going to take a week-long vacation. I'm going to go for 2, 3, 4 weeks. You and your wife, you guys travel on weekend short trips. You take weekday trips sometime. How do you navigate that tight travel schedule?
I mean, traveling is something that kind of, I guess, is my blood since I was a kid. My dad is someone that used to travel quite a bit. I remember it started actually when I was 7 years old. My dad had immigrated to the US with the intent that he was going to always go back to India. And his dream was to go back to India, but see everything on the way. So he actually did this trip that took him 3 months where he basically drove his car to New York. He put it on a ship to get to Antwerp. In the meantime, he flew off to England and covered all of England, stuff like that. Came down to Antwerp. It was basically my mom and my dad, and then myself, and then picked up the car, and then we basically drove, not we, but my mom and my dad drove for 3 months all the way across 17 countries, 22,000 miles to India, basically. So this was like the start of like amazing journey per se. And I mean, traveling at that time was very different than traveling right now in the sense that there is no Google Maps. You basically have to open up these big maps and stuff like that and kind of figure out your way, how you're getting places. He didn't have hotel reservations ahead of time. So he's a professor. So he had some students from different countries that he kind of called up and say, hey, I'm in the area. I want to get here, there. And so it was much, much more adventurous at that point in time. And as vegetarians, food was also a big issue in terms of figuring out stuff. But they went their way and it was an amazing trip back then.
And you were 7 years old?
I was 7 years old at that time.
Oh my gosh. Yeah, but I can't even imagine navigating now without, my iPhone or Google Maps. I do remember
Right.
I'm young enough that I grew up in the era of paper maps and
exactly. Well, you have to sit there and actually kind of plan out where you're going to be making turns, stuff like that. Now it's really easy. I mean, just like you told me, okay, I just put an address in. I don't even care where the hell the car's taking me. Sometimes you get in trouble because Google may take you to the wrong spot, but for the most part, it's made things so much easier.
It's so nice. It's you don't even have to, because it used to be if you miss a turn or you miss an exit on the highway, now it's like you got to pull out the maps, you got to pull over at a gas station, maybe ask someone for directions, figure out where you went wrong, and now it just reroutes you automatically.
Yeah, but getting back to your original question, I feel like exposure to different countries, different cultures, things like that, just kind of broadens your overall perspective on things. And so the two things that besides ophthalmology, the two things I'm really passionate about is traveling and family. And I feel like the more time you can spend with family, basically, I feel life is basically creating memories. And the more time you can do creating memories, that's really all we have. Like when we pass, basically, you can't take your money with you, but what you can take is all the experience you've had with various people, stuff like that. So I try as much as possible, if we are fortunate enough to do that where we can.
So are you big into photography, documenting, taking videos, photos?
So I used to be, but now I think usually if I'm going with my daughter, I don't have to worry about stuff because she's going to be taking all sorts of videos, photography. So I can just kind of put stuff away and she'll take care of everything.
My family's very big into traveling as well. And so we used to travel, not as much during the medical journey, but we traveled quite a bit when I was younger. A lot of hikes, a lot of national parks. My dad's very much into photography. And so when I started traveling, when I got older on my own, you go to these ophthalmology conferences, maybe take an extra day or two here to go explore. I wanted to document everything. I wanted to take nice photos, nice videos. And what I realized most of the time was without, even as good as the cameras are on our cell phones, they just cannot capture the magnitude of, the ocean or nature. So I realized I was just always pulling out my phone, pulling out my iPad even just to take photos. And I said, you know what, I got it up here. I'm just going to enjoy it.
And that's the same thing now. Now in the last few years, I basically just sit back and really don't even take any pictures per se. I just kind of enjoy the moment at that time.
Yeah, I'm the same way. And then my mom's always asking, can you send us photos? I'm like, you know what? I forgot to take photos. I was just enjoying the experience. I didn't document it.
Right.
My natural instinct or reaction is not to pull out my phone to post on Instagram or, Snapchat or TikTok. That's not in my DNA.
Exactly.
And it takes a lot of time. I don't know how your daughter does it as sort of a full-time career. How did she get into that?
Being the social influencer thing?
Yeah. She's a professional social media influencer, right? She has
exactly. Yeah. Shivani basically is someone who she actually, after high school, her goal was to, I mean, she was going to she was accepted to the bioengineering program at University of Michigan. Thought process was finishing up in bioengineering, go to med school and continue on. And then we told her that summer, just go and enjoy yourself, do something that, because the whole, I mean, high school career was basically do all sorts of science projects, things like that. And then we told her, just do something that has nothing to do with science or engineering, just enjoy that. So she's always been into Bollywood films, basically. So she basically got an internship back in Mumbai where she could go ahead and basically work with a media influencer called Miss Malini. And she spent a whole 2 months out there and she loved it. She was passionate with that. In fact, I got a phone call from her saying, Dad, do I have to come back to the US? I love it here. And I figured out I'm going to go join Jai Hind College in Mumbai. I don't have to come back to the US. I said, okay, just hold up here. You need to at least get back to the US, finish your education, then we'll figure things out. So she came back to the US, did her undergrad, changed from bioengineering to communications, and finished up her degree. And then at that point in time, she basically said, okay, well, I've done my degree now. She got a whole bunch of corporate jobs, but she said, I want to go back to Mumbai and just live out my dream. So she actually went back there and lived for 2 years. And she would go ahead and meet with different Bollywood stars. She would interview them, was a co-host in a TV show, things like that. And basically after 2.5 years, then she decided to migrate over here. But that time she just developed this group of followers. And now she has a couple different platforms, almost like 700, 800,000 followers, basically.
She's got a massive following. I was just checking sort of her socials, and I was like, I mean, her wedding proposal, right, alone has been seen 10 million times on YouTube.
You're absolutely correct, yes.
Who knows how many more on the other platforms. So, I mean, as her father, you're seeing her baby grow up. You're seeing her become this influencer, attract all this attention. What is that like?
So it's something that's taken a period of adjustment, because I think the hardest part for me is not so much the social influencer side, but you grew up where basically you want your kids to have some career path where you know they're going to be stable. And most traditional jobs, you kind of know what the arena is. I mean, okay, med school, I have to go through med school, residency, I could become a doctor, want to be a lawyer, XYZ, engineer, XYZ. But this social influencer is something that I have no clue about. And it's something I've learned to kind of, as long as the kids are enjoying themselves, doing what they're passionate about, I always feel like if you work hard at something and are good at it, then you'll kind of make your way work out. And she's actually figured out how to potentially monetize this and doing well with it. So at this point in time, yeah, I mean, it's working out great for her.
There's some influencers who focus on, their profession. Maybe, there's some doctors who are very influential on social media and they focus on patient care, relating stories. But you are someone now where your daughter is such a big influencer, has such a big following. And not only is she sharing things that she's involved with, but she's sharing you, she's sharing the family. So it's almost like your whole family is on social media. Your whole family is on the internet.
Actually,
that's
you're
very
right.
different. What's that like?
Yeah, so it did take some period of adjustment, because basically, like, I have a lot of employees and technicians that follow Shivani just because they can get the inside scoop on myself, per se. A lot of times I may go to work and I don't even think about it, but people have already known what I've done on the weekend or things like that. So, I think one of her biggest things is authenticity. And the thing that she really preaches is a lot of what we see on social media has been curated, meaning that you just see the best side of things, like people went on a trip, this, that, whatever. And her whole thing is that there's a journey everyone goes through. And through that journey, there's good and bad. And it's important to document everything, because if all you see is all the good, then you think that, well, you start getting kind of depressed internally that, hey, I can't live that life. But if you realize that everyone has to work hard, they go through a journey. Like, we always see these superstars and we see the final point where it is. But like, I love NBA basketball. And you see these stars like Steph Curry and LeBron James and stuff like that. And you see the final end product. But what you don't see is, well, how much time did they spend in the gym, gutting it out? I mean, missing shots, stuff like that. So I think that's something that she's really into. And so from that standpoint, as long as we just act normal, I mean, a lot of times we poke fun at ourselves and the whole family gets into it. And I mean, I think a lot of times I'll have just last weekend, I had someone come up to me and say, oh, I saw you went to Costa Rica last weekend and you did this, this, and this. And I was like, I'm kind of gotten used to it at this point in time that things are out there, per se.
What was it like when the cameras were first on you?
At first, it was a little awkward. I mean, you're kind of like, you're trying to make sure, okay, am I dressed properly? Are things looking right? Stuff like that. You try to make it more curated. But now it's sort of like this. I mean, we're just sitting here kind of talking and it's just being normal per se.
I was the same way when I started this. I was like, I've done plenty of public speaking since I was very young. So I feel comfortable speaking at length, speaking in front of large crowds, but I've never spoken exclusively in front of a camera before. So I was like, okay, I know the conversation is going to flow. I know the audio video quality will be fine, but I wonder how I'm going to react when the lights are on me, when the camera's on me continuously. And I felt the same way at first. I recorded a bunch of stuff and it was easy to kind of get used to talking or looking directly at the camera. But I was so worried about, okay, what does my hair look like in the shot? What do the clothes look like? What is the lighting? And now I just I don't even care.
Well, it's sort of like the same way that if you, like when we're performing surgery or we're doing LASIK and stuff like that, we've got these huge windows where everything is just out in the open. We have family watching, things like that. And at the very beginning, it can be very nerve-wracking. But then after a period of time, you start just acting like normal and don't even think that someone's watching you. And I think it's one of those things, it takes time. You develop confidence in what you're doing, but you feel comfortable with that overall.
Yeah, and then you realize it's one of those things, if you don't really care that much, if you're in it authentically for your own experience and not so much maybe what someone else is going to think or perceive or judge you as, then it doesn't really matter. So
right. Exactly.
That's one of those things. There's always going to be people who are detractors or haters or who are going to, they see you doing something and they want to push you down or poo-poo you. And it's like, if you don't really engage with that negative energy or even give it any mind space, then, it doesn't really affect you.
But it's easier said than done. I'll be quite frank. I mean, I don't have to deal with it that much, but I know Shivani, my daughter, has to deal with a lot where there's a lot of stuff that's posted and you have to kind of see how to ignore all that, because even though a lot of it is positive, you tend to gravitate towards those few negative comments per se.
Right. Like in the YouTube comments section, the comments that rise to the top are usually not the most productive or insightful comments.
Right.
They're the ones that are more inflammatory and getting a lot of responses.
Exactly.
So it's kind of like the modern day news media, right?
Correct.
What gets put out there, all the negative news,
all the sensationalism.
All basically. The sensationalism. There's so much good happening in the world, but what gets clicks, what gets views, it's the sensational, a lot of times negative stuff.
Exactly.
So I want to go back to, you were talking about when you were young, 7 years old, 3-month trip. But again, you and your family take these micro trips, day of surgery, and be like, oh, how was yesterday? And you're like, oh, I drove up here and had dinner at this nice place, took a boat on the river. And I'm like, how are you managing your time? How are you doing this?
Yeah. So it's one of those things that, like, for me, my life is one where weekends are pretty much that I come home, usually on a Friday, and I'll ask my wife, because she's kind of the social planner. I mean, I'm doing my stuff out of time, and then the expectation is there that every night there's going to be some type of engagement that we're going to be doing something. We're going to be going to someone's house. Usually there may be a group of maybe last night I flew in from New York, and then that evening we basically had about 7 or 8 families that were gotten together for dinner basically. So we stayed up and basically ate with them. Then we come to this. As soon as I'm done here, I've got another thing at lunchtime where I've got another 6, 7 different families that we're getting together. So we tend to be very social from that standpoint. But it's one of those things that my wife fortunately can plan all that stuff out. So I know that on weekends, we're going to be doing all of that. And then we just love doing activities. I just quickly go over in the next couple of weeks. I've got a trip to Amsterdam planned. Then I'm going to Kashmir in India overall. This year's actually, I think we're making up for COVID, because for 2 years we were pretty well shut down and couldn't do stuff like that. And normally I'm typically used to doing a couple of international trips a year. But this year, besides my daughter getting married back in January, December, then we took a trip to Croatia, and then we've got Amsterdam, Kashmir. I've got Croatia. Again, I've got small trips in the U.S. Like I've got a trip to Newport, Rhode Island that we're working on, Acadia National Park. And then I'll be doing another trip to potentially at the end of the year to Indonesia, maybe India. So, yeah.
A true world traveler. So is it your wife that does most of this planning? And how do you guys go about, when I want to go travel someplace new I've never been, sometimes you look up, all right, fun things to do in X, Y, and Z city. And sometimes those lists don't really align with what I'm interested in. So I found it's a lot easier to go on YouTube or Instagram and find cool places. You're like, oh, that seems nice. But how do you go about navigating? And I feel like you could be a travel agent at this point.
No, we've been to probably about maybe 80 countries or so. And I will tell you, planning is probably one of the hardest part on trips, because the easiest thing would be to go on a prepackaged tour, but we've never found that that works for us. We typically like to do our own things and try to do it. So I think probably the number one place where we start is we've got such a huge extended family and network of friends that typically someone or the other has done this trip before. Like I was just talking to my wife this morning and she was telling me how we were just plotting out who are the people that have been to Indonesia that we know of. And we know at least 4 or 5 people that have been to Indonesia. And typically, like word of mouth, we'll go ahead and ask them and say, so what are the sites that you liked? What did you see? Stuff like that. So get lots of ideas. Once we get an idea of where exactly we want to visit, then the next step in our minds is there's basically 2 big aspects. One is your flight tickets, because that's the part that's really expensive. And you want to kind of figure out what's the most effective way that you can make it work. And especially if it's a quick trip, then like Costa Rica was easy. That's basically just one connection. You're right there. But sometimes it's multiple connections. So got to work that out. So get your flight ticket. And then after that, it's basically once you know your locations, then I love using TripAdvisor as far as finding hotels and trying to determine where you want to stay. And then activities and food, probably restaurants. That's the second big thing. And usually just asking people, we can get a good idea of what we'd like to do. So it does take some time and effort. You're absolutely right as far as that's concerned. But we found that for the most part, once we get through that initial start, then it goes pretty well.
How was Costa Rica?
Oh, Costa Rica was awesome. I love it. In fact, for me, one thing that's people often ask me, will you go back to a place again? And it is, besides going to India for extended family, I typically will not go back to another place just because there's so many places in the world to visit. So I'm not the type of person that will necessarily have like a second home where I'll go back to that home repeatedly. I'd rather go to many different places inside there. But Costa Rica is unique because this has been my 3rd trip now down to Costa Rica. And it just has worked out where it's come on different milestones. I went there on my 10-year wedding anniversary. At that point, it was just myself and Shalini were the 2 people who went out there. And part of the reason why we like Costa Rica is it's very compact. There's not much of a time difference, so there's not much jet lag that you have to deal with. It's only 1 hour. It's Central Time Zone. And then you've got a whole variety of activities. So we're someone that we don't necessarily are into so much the historical side of things, but we like to go to places and do things, and so Costa Rica is great from an adventure tourism perspective where you can go ahead and have lots and lots of activities. So we went there on our 10-year wedding anniversary. Then on our 20-year wedding anniversary, I went with both kids so they could go ahead and see stuff. And this year, come December, it turned out it's going to be our 30th wedding year anniversary. I was just shocked when I said, oh my God, 30 years. But this time we went with 10 people, my parents and whole extended family, things like that. So had a blast. It was awesome out there.
Yeah, that sounds great. I've wanted to go for so long. And I mean, I haven't really just been to that area in a long time. And going to Puerto Rico for Caribbean I was really excited. And then it just rained the entire time.
Yes,
I was
exactly.
hoping to do a lot of hiking, tracking along the coast.
I can tell you Costa Rica is so different than even like Puerto Rico, Cancun, stuff. Like one of the activities we did is we basically were rappelling down a mountain face and there was a waterfall coming down and you basically have water coming down your face as you're kind of rappelling all the way down to the bottom. So that was one activity. Another activity, they have these hot springs where you can sit back, natural hot springs. So there's a volcano where the hot water comes down and you basically enjoy the natural springs and stuff like that. Another activity is where you basically can go into a cave, go spelunking down there. There's sometimes where you're kind of crawling down there. And some people may not find this enjoyable. They may think, oh my God, this is scary. But I'm like one of those things that life's about enjoying yourself, having experiences, trying different things. So that's right up my alley per se.
Yeah, no, I feel the same way. I've never been big on history. I think my parents are a lot more into that stuff. And so when I go somewhere, like if I'm on a solo trip, I'm like, oh, check out this historical monument. And I'm like, well, I'd rather go hiking.
I mean, it is fun to see certain things like that. But at the same time, I love a combination of things inside there. Like South Africa was amazing from that perspective, because in South Africa, you have both activities that you can do, and then it is fascinating to go and see where Nelson Mandela was basically kept in captivity for a period of time. You can go and see Mahatma Gandhi's original house before he moved to India. So I like it if you can get a combination where you get maybe a little history and activities and things of that nature.
South Africa has been on my list since 2015 because I was planning immediately after step one to take a few weeks, go out there and go cage diving with great white sharks.
Right.
I ended up pushing my test date back, so that never ended up materializing, but it's still on my to-do list. But to your point about Costa Rica and having been back multiple times, for me, that place is Iceland. And you went last year as well, right?
I went last year.
Yeah,
Yes.
I think we both went last year. I did the whole sort of southern part of the country, but there's still so much out there that I haven't seen.
Yeah, and you don't realize, and actually, a lot of people go there in the winter months to try to see the northern lights. But Costa Rica is Iceland is so beautiful. Even we went there during the July 4th weekend time frame, and the colors are so vibrant. I think part of it, where you're located, when the sun is shining during that golden hour, it's just the greens are so green, the blues are so blue, and just I have never seen such magical colors as right out there.
The vibrancy, and then I feel like everything there is the purest form that exists on planet Earth.
Because tourists have not really messed it up yet.
Right. So like the water, some of the cleanest water I've ever imbibed. The air, so fresh, so clean. I mean, it sounds silly to say, but just being out there, I felt my level of physical well-being just slowly elevating, just taking in that Icelandic air.
Right.
The black sand beach
Yes.
lived up to the hype. I mean,
Absolutely.
That was incredible. So what I did was we had some water bottles and I filled it up with sand and pebbles from the beach, smuggled it back into the country. And so now I have a nice glass dish filled with all the black sand. And if you fill it up with water, it kind of replicates sort of what that looks like in real life. So that's my little piece of Iceland that I stole and brought back. So you say you like making memories, traveling. Do you feel like with all of these 80 countries you've been to, all this travel, seeing all these different cultures, gaining new perspective, do you feel like it's enriched you and you've grown as a person? Do you feel like you go about everyday life, interact with patients? Do you feel like that's really cultivated and given you new perspective?
Yeah, I mean, I think for me, a lot of it is just we in general tend to get upset over the smallest things. And I think that my overall view on life is, and hopefully you've seen this during this past year, that I typically do not get pissed off or upset about things. I mean, I think life is just too short to worry about things. There's just so much amazing things out there. And so when you go see all these things out there, you realize that the small things that may not quite go the way you want it to or stuff like that is not really worth doing. So I do feel that my mindset has changed over time. I used to be, when I was younger, the smallest things would make me upset. Like if I wouldn't get the right food at home, when I got home, I'd be like, oh my God, what happened? Why isn't it tasted this way? Stuff like that. And now I'm like, we're just so blessed to be able to do what we do. Number one, ophthalmology is just awesome. And then to be fortunate enough to be in a situation where we can go ahead and do all these different types of activities and things like that, spend time with family. So I think that's probably made me realize. And the other thing I think you realize is, you realize how fortunate we are to be living in the United States of America. Because we sit here and many times we may complain about a lot of the things that aren't quite the way it should be. But if you look at what we have versus what the majority of the world has, you start to appreciate that even something as simple as, like I remember when I go to India, a lot of times we would go ahead and basically we'd take a bath where we'd have to fill up water with hot water into a bathtub, and then you just take basically a mug and you're just kind of pouring on there. So when you get back from India and you sit there underneath a hot shower, it's like so refreshing. So all of a sudden a shower is no longer just a essential need, but it's sort of a luxury that you really enjoy. So those are things that you start to appreciate when you go to different countries.
That's so true. You're bringing back all of these memories of India. I used to go almost every other year, and we would go for 3 months every summer. If I wasn't in the specific city where I had cousins my age, it was the adults all interacting, and it was just me by myself. Eventually, you've read enough books that you get tired of reading. You've played enough on your Game Boy, even the Game Boy gets tired. And then you're just kind of left with you and your thoughts in the dead heat in the Indian summer. And I remember taking showers, like 2-3 showers a day. And it was the same thing. You just fill up the bucket with a lot of water and then kind of just wash yourself like that. So yeah, traveling to places like India and other countries like that really does give you perspective on how blessed we are.
We're just fortunate over here. Absolutely. Yeah.
There's some people who feel that exactly what you related is that travel gives you this great perspective. It helps grow you as a person. It enriches your quality of life. You get to see the world. We're on this massive, amazing planet, and there's so many people out there, so many great places to see, an infinite amount of things that, unfortunately, try as hard as you might, we're never going to get to see everything. When I was a kid, my goal was I'm going to visit every country on earth before I die. That's still a goal of mine, but it's probably not going to be realized for a very, very long time. But then there's others who say people who travel all the time, people who are wanderlust, they're searching for something or they have some part of themselves that's incomplete. Wherever you go, there you are, essentially. You can't escape yourself.
No, I think it's everyone's perspective. And I think the two hardest parts about traveling are you need time and it's expensive. You need a lot of money as well, as far as that's concerned. And if you're fortunate enough to go ahead and make that work out, that's great. I mean, I think that's part of the reason why my perspective has always been that when you work, you want to work really, really hard. You don't want to sit back and take it easy. So my whole philosophy is when I'm going to be in the office, I'm going to be really kicking butt, just going as hard as possible. But then when I'm out of the office, that's why I do these small little excursions, because I want to maximize as much time as possible. I mean, whenever I've got free time, I want to at least say that I did something productive. Because, I mean, don't get me wrong. There are times when I'd like to just sit back and take 2 hours and just basically chill in front of the TV and not do anything from that standpoint. But I kind of feel like even something as simple as we've got a fantastic Metro Park system here in Cleveland. If you want to go ahead and go biking on the hikes or go hiking or just do something that you are enjoying yourself. It doesn't matter what it is. Just if you enjoy that, then you're having a good time, basically.
It's really been amazing to see you have this duality of your lifestyle where it's like work hard, play hard, build to that same effect as well. You guys are doing 30 to 40 cataract surgeries in like a half day, multiple days a week. And then you have clinic afterwards. There's some days of the week we operate 5 days a week. And it's awesome to see that hard work contrasted with travel and all this fun you guys are having, because I feel like you go through high school, you go through undergrad, 4 years of medical school, 4 years of ophthalmology residency, maybe a 1 or 2 year fellowship after that. Some of our colleagues who aren't in ophthalmology, neurosurgery, 7-year residency, 3 years internal medicine, 3-year cardiology fellowship. It is a long road.
Absolutely.
And I feel like some of the surgical specialties, especially, you just live in the hospital and it's easy to lose sight that there is a light at the end of the tunnel. So it's really been awesome to see you and Bill enjoying your families, enjoying life, traveling, but also still taking exquisite care of patients.
Yeah, no, I think it's something that I feel what we're really lucky about is in the field that we're in. A lot of people take the field and, I mean, I think we go extra hard than the average person per se. But I feel like by doing that, at least the time that we do have that we can take away, we can truly enjoy that per se. So we're not like tied. I think what's hard is when you are going through that process of med school residency, stuff like that, that's all you see the whole time. I mean, you don't see anything else out there. So you wonder, okay, well, maybe this is what I'm going to do my whole life per se. But then to have the opportunity of going ahead and trying to do other things, I mean, and whatever it is, I mean, we kind of do traveling quite a bit, but some people may have other passions, and whatever that is, just go out and live it to its fullest.
It's easy, I think, when you've moved on from one stage of life to the other to stay focused in the present and not live in the past. And I see it myself in peers when, do I truly remember exactly what it was like to be in med school and to be studying 14 hours a day and doing nothing else, going to lectures? And you look back on it, and some people I think have that rosy retrospection, but it's a lot of work, a lot of sacrifice, a lot of time commitment. And it's easy, I think, for people to come out of it and not really have a feel for who are they, a lot of their hobbies or interests. Maybe they gave up in the medical journey just to focus on getting to that stage of becoming a physician. And people are kind of lost. And there's so many options as well, right? You become a doctor, but then what residency are you going to go into? Ophthalmology. Are you going to be a comprehensive ophthalmologist? Are you going to do cornea, cataract, refractive, glaucoma? Are you going to specialize in the anterior segment? Are you going to be a retina doctor? Are you going to do ocular oncology, uveitis, pediatric ophthalmology, neuro, plastics? I mean, we have so many different.
Just within the eye itself.
Within the eye itself. And now we have global ophthalmology fellowship. There's genetic fellowship. When you were coming out of training, how did you sort of navigate that to figure out what it was you wanted to focus on?
For me, I think, number one, when I went to med school, ophthalmology wasn't even in the picture. I actually was leaning much more into orthopedic surgery. And part of it is that besides going to med school, before med school, I'd gotten a master's in bioengineering. So my mind was very much of an engineering type thing that I got to think more mechanical. I kind of gravitated towards orthopedics because it's sort of like, okay, you've got joints, and it was very much like mechanical engineering inside there. And then, I mean, I was leaning that direction, and then I happened to run by another doctor who one time told me, it was actually an orthopedic surgeon, said, orthopedics is great, but have you ever considered ophthalmology? I was like, no, I mean, why would I be an ophthalmologist? I just want to give glasses all day long. Because that was my view of ophthalmology. It's just these are doctors, because I'd only seen optometrists. And in my mind, that was an ophthalmologist. And I did not know about all the other facets that are out there. So I just thought, well, this is just someone that gives glasses. And then I said, no, you should look into it. And then when I looked into it, the two things that gravitated me towards in that direction, number one, I think one of the biggest challenges, hardships I had when I went to med school is I don't find myself a very smart individual. I mean, I'm someone that basically, I got through high school. I did really well in high school and stuff like that. But when I got to med school, the sheer volume of information was just so huge that for the first time, that was the first time in my life that I actually struggled doing something. And I was like, it was hard for me because I'm used to being at the very top notch of things. And I think all of people in ophthalmology are used to being like at the top of their class. And I was like, oh my God, I can't handle this. This is really tough. And I didn't like the fact that I was not perfect or really good at everything I was dealing with. The beauty of ophthalmology is I said, okay, well, this is a smaller area. I can get really good at this one area per se. So that was one thing that gravitated me. And the other thing is that there's a lot of lasers. And again, there's a sort of an optics engineering background behind that. So that kind of led me to lean in that direction per se. And then I myself was a -7 myope before I had LASIK done. And this sheer concept of being able to correct vision and trying to get people that, I loved that. Even when I was going through ophthalmology, that's when people were doing RK at the time. And even RK, even though we look at it right now and we poo-poo the whole thing saying, oh my God, this was a terrible procedure. How could we do that? But at the time, it was just amazing to me that you could take someone that has been in glasses and do something like RK to go ahead and get them free of glasses. So that was just something that naturally just made me go in that direction inside there.
What point of life did you have your LASIK?
So I had LASIK basically pretty late, actually. I was in practice, and probably I'd been in practice for maybe 5 to 7 years. I myself was doing LASIK on several individuals, and I was seeing individuals that had prescriptions similar to mine and seeing how they were doing stuff like that. And I think in general, a lot of how aggressive someone tends to be comes down to your background from an ethnicity standpoint. I think I grew up being a little bit conservative in terms of, well, what happens if something goes wrong, this, that. You start thinking of certain things. And then after enough time where you start seeing, oh, this is fantastic, then I say, okay, let's take the plunge, practice what you preach. And now I'm like, full bore ahead. I've done LASIK on my wife. I've done LASIK on my daughter. It's like, if you're a great candidate, all the way.
I come from a family of myopes as well. And so I grew up and I saw both my parents have LASIK with the microkeratome.
Okay.
And who knows whether that imprinted something on me to go into ophthalmology. I'm not sure. But in retrospect, maybe. I got into medical school thinking I was going to be a neurologist, mostly because I was interested in neuroscience and psychology in high school. And then eventually realized you could make a lot of diagnoses and maybe get really good at imaging. But I felt like I wasn't doing something directly to impact the patient. I wanted to intervene and see a good outcome. I explored a bunch of stuff before I kind of finally settled on ophthalmology, but I'm surprised that an orthopedic surgeon, out of all people, recommended ophthalmology to you. What was his thought process there?
I think it was more just lifestyle. That was probably the biggest thing, is he told me that in orthopedics, he enjoys it, but there's a lot of call, middle of the night, someone has trauma, you have to go in, stuff like that. And the one piece of advice he told me is that, you're right now in this time frame where everything is medicine. And there's going to be some point in your life where you're going to decide that, well, you may have other interests outside of medicine. And if you go into a different field, you may have this opportunity of pursuing your passion. And I'm really, really thrilled that he led me in that direction, because even though, medicine has changed, and I think much more medicine are more like employee-based models where basically you've got set hours. When I was going through my training at that time, definitely certain fields would spend in a lot more hours than other fields. So by going into ophthalmology, it gave me the opportunity that, okay, now I have more free time. I can go ahead and explore my traveling and things of that nature.
But was it something he sensed in you at the time, where he was like, this guy Shamik's not going to be happy. He seems like a guy who wants to travel and enjoy life and do other things.
It was interesting. I don't think he was trying to steer me away from orthopedics, but it was more like just a consideration. Maybe he was in a stage where he was getting burned out himself. This is a guy that may be in his 50s or something like that, and he was an orthopedic guy, and I think he loves it. But it probably was like, okay, I'm so busy doing all this type of stuff.
we are very blessed to not only be physicians, but be ophthalmologists, and beyond that, be refractive surgeons, because there's still plenty of ophthalmologists who ophthalmology residency call is brutal. Like, it
Yes.
doesn't matter where you are in the country. I mean, call is heavy again because no one really knows anything about the eye, and so if anything happens, even if it's the most trivial pathology or not even pathology, ophthalmology is getting consulted. There's a lot of retina doctors or level one trauma institutions, academic centers where, even once you're past residency, past fellowship, you're still on backup call, you're still doing globe call, trauma call. If you're a cornea specialist, you're taking cornea call. And, I think we're very fortunate to be refractive surgeons where 99.9% of the time, everything goes great and our patients do well. And we don't really have that part of our lifestyle that we're still kind of having to commit to after hours.
Oh, absolutely. And I think there is that degree of satisfaction in the sense that a lot of people work because you need to earn a living and get money into stuff like that. But I truly feel that even if I won the lottery, stuff like that, I still would keep on practicing just because there's such a high level of satisfaction that you achieve because of the great outcomes we're able to deliver. And they just continue to keep improving. I mean, you look at the type of IOLs that we're now having, and I look back to what we had 5 years ago, 10 years ago, and the amount of progress that's taking place is tremendous. We're still have deficiencies that we have to continue to work towards, but I think the levels that we're able to achieve is just amazing what we can give our patients.
Going back a little bit, your orthopedic friend says, hey, consider ophthalmology, kind of lines up with your interests. So you apply to ophthalmology, you get in, you went to Michigan for residency, is that right?
I went to Baylor College
You went
of
to
Medicine.
Baylor, sorry. You went to Michigan for undergrad and medical
med school. Yes.
What was that like down there in Texas?
Baylor was brutal. I mean, because I went in there, I had not really prepared anything ahead of time. And Baylor in general tends to be a very, very tough residency. So, I mean, there's a common thought process. I think things have changed now, but where you see one, do one, teach one. Well, at Baylor, it was very much where you're do one, do one, do one, do one. Then finally you get to see one, how it's done. And then you may start teaching. I mean, we would basically, when we were operating, many times the first years, we would not have attendings with us. We'd get lucky if we'd have a third year. I remember my first day on call, I literally had a dark room, and I basically, while I was watching a patient, I kind of had the Will's Eye Manual open on the side with my pen light, just trying to read through, trying to find what the hell is going on here. How do we handle stuff like that? So I felt totally overwhelmed at that time. At the time, it was painful, but coming out of it, the beauty of that residency is that I felt like I could handle anything. There's nothing that would come to, like a lot of times our technician would call up and say, oh my God, I got this kind of. I mean, at this point in time, there's nothing that comes to the door that I'm going to be worried about how to handle. Because I think your residency and your fellowship, in my opinion, is where you want to work as hard as possible. You want to see as much as possible. You want to see all the crazy stuff out there so that when you're out in practice, that's where you can feel like, hey, I can handle anything I want to inside there.
I agree on so many levels with a lot of what you just said. It was interesting the transition from the transitional year to ophthalmology, because when you're on call or on night shift in internal medicine, and let's say you're the intern, well, you have your juniors, you have your seniors, there's attendings on call, there's nocturnists working. So you have this whole team around you. And then you transition to ophthalmology residency. And now instead of having maybe 20, 30, 40, 50, 60 co-residents, you're down to an average of 3 or 4. And when you're on call, it's just you on call. The senior resident isn't there all the time. They're there. Hopefully, if you have a good senior resident, they're there when you need them. But all of a sudden, it's you. And like, I'm sure it was similar for you in Baylor, but in Cincinnati, we took care of a massive catchment area. And so anything that was happening within 2 or 3 hours was coming to the University of Cincinnati. It's a level 1 trauma center. We saw a ton of open globes, ton of trauma. Ophthalmology in general has such a steep learning curve right off the bat. You're trying to learn the language. You're trying to learn how to use the instruments, how to use a slit lamp, how to use a 20 diopter lens to even look at the retina on call. And so those first call shifts, I think, can be really, really tough, especially if you don't have an integrated intern year or you haven't had some sort of away rotation or experience if you didn't have an ophthalmology
it's brand
department.
New. It's like you have no clue what's going on.
Right. And so that's what I tell people when they come to me and ask, hey, what should I look for in a residency? I oftentimes will say something that I think can be really beneficial is having resident-run clinics. There's 2 extremes to that. There's resident-run clinics kind of where you don't have an attending and no supervision and you're just kind of left to fend for yourself. But then there are those resident-run clinics where you are the physician, you are the ophthalmologist, you are taking care of the patient, you do everything, and then you go present to your attending. And then the attending comes in and then we'll either confirm or say, hey, take another look here. This is what this is. And you get some teaching out of it. And I think that is so important because, like you said, when you graduate, then you have that sense of autonomy. Hey, I've been through this on my own before. I know what this is like. While you still have that teaching. And so I think that can be really, really beneficial for people coming up.
I think the other thing that a lot of people take for granted is doing microsurgery is hard. I mean, we come out and we see a lot of all these individuals at conferences and stuff like that, and they present these amazing, elegant cases, stuff like that. But cataract surgery can bite you really, really quickly. And the moment you take it for granted, it hits you. And it takes a while to basically, there's some of us that, like my partner, Bill Wiley, he's just naturally gifted with his hands. It's just amazing how well he does. But I look at myself, to be quite frank, I actually felt sorry for my patients at the very beginning of my training. Like the ones who ended up coming with me, I said, oh my God, poor guy ended up with Shamik Bafna. I mean, he's not a very good surgeon. How is he going to do it? And stuff like that. And it was so bad that I literally would throw up every OR day just because I would get a pit in my stomach. I was like, oh my God, this is so tough. I mean, I'm going to have this problem, stuff like that. And you have to kind of, for all the people starting out, you just got to get through it because microsurgery, no matter what anyone says, you can't take it for granted. It's something that does take time. If you practice, work at it, stuff like that, you can become good at it. But a lot of us just take it for granted. You just get there immediately.
Yeah, microsurgery, when we're talking about ophthalmology, you literally have someone's vision. You have their sight in your hands, at your fingertips. Most people, I think the hallmark of a really good surgeon, like a maestro surgeon, is an onlooker or someone who is not an experienced surgeon or someone who's just a layperson can look at that and say, oh, that looks pretty simple. Like you watch Bill Wiley, you brought up, Bill I'm fortunate to have worked with a lot of really good surgeons. I've worked with a lot of really great surgeons. I've seen phenomenal surgeons at work. There are a few people that I would put at like God tier level in terms of surgery skills, and Bill is one of those people. You just watch him and do cataract surgery in 4 or 5 minutes, and it's just exquisite. The interplay of his fingers, the instrumentation, everything is happening the first time when he wants it to happen. And I have to tell people, because we have so many visitors, medical students, fellows, residents coming from out of state or industry comes in and they want to see something. And when I'm narrating, I have to really emphasize to them, this is not typical surgery. This is surgery at the highest level. I mean, this is like watching Roger Federer play tennis or Tiger Woods play golf. This is like the pinnacle of what surgery looks like. And people forget because surgeons have become so good. We can do cataract surgery in 5-10 minutes. Before it used to be 30-40 minutes. You used to be admitted to the hospital, have to stay overnight for multiple days. People's eyes hurt. At some point, we weren't even putting in intraocular lenses. And to your point, you were bringing up the progression of technology, the advancements we have. Things have gotten so good. It's really, really hard to appreciate, I think, unless you yourself have been in the trenches, have seen what can go wrong, have experienced complications. So like I'll see, Bill in a situation sometimes and people will be like, oh yeah, that was supposed to happen. And I'm like, you don't understand the amount of skill that went into that 1 second maneuver because everything we're operating within millimeters, right? Of course. 2 to 4 millimeters, sometimes less than that. And it's the slightest depression of the heel of your hand or the slightest movement left or right. There's just so many exquisite things at play. And the pressure, I don't think most people realize sometimes until, like for me, it was at the end of a surgery day. I'd be like, all right, it's like 3-4 p.m. We did a lot of surgery. Why am I so tired? Like I got a lot of sleep last night. I'm hydrated. I'm caffeinated. It's just you're so focused. Your entire being is focused on taking care of that patient, restoring their vision, taking care of their sight, enhancing their ability to see. And that takes a lot of pressure.
Yeah. No, you don't realize mentally how taxing the whole thing is. Absolutely. Yeah.
So I want to break down. You said like initially and first of all, I hate that you always are like, like you are an amazing surgeon. I've had the privilege of being able to work alongside you and see over the past year. You're a phenomenal surgeon. I mean, I try to emulate a lot of what you do. So I don't want you to keep saying this for everyone listening. This is a fallacy that he's propagating, that he's not. I mean, you are just as good of a surgeon, as Bill. Your outcomes are phenomenal. The patients are just as happy. Like you're a great surgeon. I really feel blessed to have been able to work with you and learn so much from you. But going back to like what you were talking about early on in residency, the pressure of surgery, how did you deal with that? What were your attendings thinking when you were like anxious or nervous or, having to vomit or puke or take some time to kind of compose yourself?
So I will say that it was not something that was necessarily public knowledge per se, because I didn't want it to be out there. Oh my God, I'm having so much struggle, stuff like that. I was married at the time. My wife definitely knew the challenges I was dealing with. But one thing that I did that helped me out was basically doing a lot of practice surgery. At the time, it was very easy to get cadaver eyeballs. And in fact, I would go ahead and actually get cadaver eyeballs and basically go ahead and practice doing surgery on the cadaver eyeball itself. Now, we didn't have these nice little things to kind of hold the eyeball in place, stuff like that. So after you were shouting loud cry, she actually would come into the OR and she'd actually hold the eyeball while I'm going ahead and doing stuff. So sort of us bonding together inside there. In fact, the funniest story is that I would sometimes get these little cadavers or be in these little microscopic jars, and I'd kind of bring them home, and they'd be like a certain area in the refrigerator or something like that. And then one time we had a relative that come. My father-in-law actually came to visit us, and he opened up the refrigerator and it was like, oh my God. And after that, he never opened up the refrigerator again because he was like, oh my God, I don't know what I'm going to find over here. But side story here. But I think what it comes down to is just being confident enough that no matter how difficult it is, that if you put forth the effort, you will be able to get through that. I mean, one of my favorite sayings is, I hope I get this right, but hard work beats talent when talent fails to work hard. And ultimately, I do feel that I'm a good surgeon at this point in time. I always try to be humble. I'd rather let other people say, like I literally, last week, I had 2 patients while I was operating saying, oh, I heard that you're the best. I heard you're the best. I'm just basically telling them that I don't know who's telling you this or whatever, but no, everything is great, whatever like that. But it's one of those things that I think as long as you're humble and just don't take things for granted, I think a lot of us just make it seem like we're like amazing stuff out there. But I think it's important to understand that ultimately these are patients that are depending upon you, and you want to go ahead and do your best for that patient. But when you go ahead and work through that, I think you start to basic maneuvers like even just simple as a capsulorhexis. I mean, we go through it and it seems really easy, but that maneuver it takes a while to kind of get all the vectors down and why you're pulling in this direction and that direction. I can't tell you how many times as a resident, I'd start pulling and my rhexis would go around the wrong side or this side or that side. I mean, I had way too many. In fact, a true story, like during my fellowship, I actually got pulled off of doing cataract surgery for 2 or 3 months just because I was having so many challenging cases at that point in time. My preceptor was like, hey, we just can't have you. It's not, I mean, that's, and again, it was more me than anything else. But I think the key is even when you go through these ruts where a lot of us will go through these times where you have like maybe 2 or 3 tough cases, just now you kind of have to sit back. And I think videotaping is really critical. We have that access that we can sit back, analyze. I think the fact that we've got access to YouTube videos, phenomenal, because now we can go ahead and anytime you have a challenging case, difficult case, you can kind of look and mentally prepare. And I think a lot of it is just kind of going through all the steps, trying to think in your mind, okay, well, this is where I'm going to that. And paying attention to a lot of details in the sense that I think where engineering has helped me out is to try to understand why did I do what I did? And is there any way where I have wasted steps? The goal in my mind is not necessarily to be a fast surgeon, but more to be an efficient surgeon, meaning speed will come naturally. You don't have to work towards fast. But if you make sure that you don't waste steps and try to understand why you did what you did, then I think you gradually evolve towards where you're going to be inside there. And so there's definitely, volume definitely helps. I mean, I look at yourself and where you are right now at the end of your fellowship versus at the very beginning. I mean, you start off being a good surgeon, but definitely through volume, through experience, I mean, you yourself can probably see how much more confident you are in being able to handle different things and things of that nature. And I think there's definitely something to be said to when you go through this whole stream of volume. I mean, I really feel like a fellowship like this, you almost get like 5 years worth of experience condensed into 1 year where you can come out and just get everything off the bat.
Part of being a good surgeon is having the confidence to be able to handle sort of whatever's thrown at you. And if there is a complication, knowing how to handle that, how to get through that. Every cataract surgeon's worst fear is breaking the bag or having a tear in the posterior capsule. But if handled appropriately, if you maintain the proper pressure dynamics between the anterior and posterior segment, a lot of times the patient will still see really great and not have any issues if it's handled appropriately. So when in your journey, was it in residency? Was it in fellowship? Was it in the first 5 years of practice? Did you feel like you had finally got that confidence and you weren't so nervous or worried about operating?
Yeah, I would say probably in my first 5 years of practice. And the reason for that is when you're in residency and fellowship, the nice part is that you do have a backup. You have someone out there. But when you start your practice and you are the main person, everything falls upon you ultimately. And so everyone is kind of a different level of confidence when they're finishing up per se. But that's where you gradually get to a point where you have to know that, okay, I'm the one that is going to be the final endpoint per se. And I got to make sure you're doing something of that nature. I think the other thing that changes, my style of practice today is very different than my style of practice when I first got out of school. And right now I do a lot of co-management, whereas before I did not. And what I will tell you, one of the benefits of co-management is, or whether it's benefits, whatever, one of the aspects of it is that you cannot really hide your mistakes, meaning that once you do the case, you're going to be having someone else potentially go ahead and evaluate those eyes. So if you have a complication, things like that, I mean, it's going to be out there. So you need to be able to produce some type of result, no matter whether there was a complication or not, that the co-managing doctor feels very comfortable handling. Of course, there are going to be some situations where you're going to continue to handle those yourself. But at the very beginning of my career was something where I was handling most of that on your own. And when you do that, then you basically, it's easier that if there's not quite what you want it to be, you can kind of work through that and figure it out. So I think it's a gradual evolution process. And everyone kind of goes through that journey at a different time frame, I feel, when it comes to microsurgery. Some of them, it's very compact right within the residency itself. They're finishing up and they're really confident, really good at that. I think we have much better tools these days than we did maybe 20, 25 years ago. And so it's much easier, I wouldn't say easy, but we've got other resources available to try to assist individuals in getting through that surgical journey.
I agree with that. So let's go back to when you were finishing up residency. What drew you? You did a cornea fellowship, right?
Yes.
New England. What led you to want to do that? Did you always know you wanted to do cataract surgery, like for the bulk of what you do? Or did you feel like doing a cornea fellowship was the way to get there?
Yeah. So for me, at the time I finished up training, it basically was broken down into, you could do a retina fellowship, glaucoma fellowship, you could do a cornea fellowship. They really did not have a refractive fellowship. In fact, they really don't have a refractive fellowship right now. It's kind of part of a cornea thing. And when I chose a cornea fellowship, it was something where I want to choose someone that had an aspect of refractive surgery within that. So even though there was cornea where you were doing transplantation, things like that, there was some level of refractive surgery. These days, I think there's fellowships where it's much heavier on the refractive side and not so much on the cornea side. But that was the only way at that point where I could go ahead and become better on the refractive side of things. Because I did know that I wanted to have some refractive surgery as an aspect. At the time, I was when I got into practice, more of a comprehensive surgeon with some refractive surgery on the side. Very different than the practice we have right here.
Coming out of fellowship, the way you practiced or the practice you were at, very different than
Correct.
Where we are right now. What were those first 5-10 years of practice like before you met Bill Wiley, before you came to the Cleveland Eye Clinic?
Yeah, so, I mean, it was a style of practice where it was more of a comprehensive surgeon. I was in a multi-specialty group, not just multi-specialty in terms of ophthalmology, but a group of maybe 100 doctors that included family practice, neurosurgery. There were 3 ophthalmologists in the group, and all of us were comprehensive surgeons. So we would go ahead and treat all aspects of care. In the community there was no real glaucoma surgeon you basically did everything per se. So I would go ahead and do that. And then I would one day a month go ahead and do refractive surgery as well. Now, when I did refractive surgery, I did all the pre-ops, determined the refraction. I had a roll-on, roll-off laser that would come in. We'd go and do a procedure, and then I would take care of the patient post-operatively. And it was style practice. That's all I saw, all I knew. I did not know that there was other aspects out there. It's just by chance that about in my 9th year or 10th year out there, the whole system was being bought out by a hospital-based system. And all of the doctors, the compensation was being changed to more of a employee-based model, as opposed to before it was more of a productivity-based model. So we're all going to become salaried employees. And I was still relatively young where I felt like I did not see myself in my long-term career of being in that type of environment. I wanted to do something more inside there. So that's when I started looking at other opportunities. And it was interesting because prior to that happening, my mind thought that this was going to be my final place where I was going to retire. I mean, I actually had went ahead and built this dream house. We had like 8,000 square feet. Beautiful. I had imported marble in from India and just made it very customized, stuff like that. Because this is where I thought was going to be a final thing. The funny part is that's the house that I probably spent the least amount of time in than any other place I've been at. But we went ahead and I started looking for different things. And just by chance came across Bill. I actually talked to one of my phaco reps. And my phaco rep said, hey, you may want to consider talking to this person. And Bill, I guess, had been looking for someone for almost like maybe 3-4 years and did not want someone fresh out of school, but someone that had decent experience, decent hands, things of that nature. And the challenge, I think, always is that if someone is pretty good at what they're doing, they're probably not looking for a job. They're probably going ahead and doing what they want to do. So just by chance, I came across meeting Bill at that time, and things completely changed at that point in time.
I see you and Bill, sometimes both of you, the same day, multiple days, almost every day of the week. So I sort of take for granted the family we have, but I'm so curious, like what was the setting you met Bill in? You know, how did that conversation get started?
Yeah, it was one of those things that it was weird. I was on my way to attend a conference in Vancouver. It was somewhere in the winter months, and my flight got canceled. So I'd already taken some time off. And just on the phone, talked to Bill, and we'd said, okay, at some point we're going to create an interview. And so I called up Bill at the airport and said, hey, I have this time off. What if I come to Cleveland instead? I said, sure. So I actually came out to Cleveland at that time. And basically, that's the first time I met Bill. We sat down at a restaurant close to his house and just kind of talking about different things. At that point in time, we did not have a surgery center, this Brecksville where you spend your time. That did not exist. It was basically a piece of land. And we kind of drove around, and he kind of talked about, we only had, currently we have, I think, 10 or 11 different locations. At the time, we had 2 locations. And so Bill mentioned how he's got this piece of land over here. In the future, he'd like to build a surgery center, like to do that. We kind of talked about our views of refractive surgery. At that time, we were just getting into premium lenses and upgrading cataract surgery. And Bill were talking about the challenge of how do you determine who you want to upgrade and who you don't want to upgrade. And very, very infancy of this whole thing. And we kind of talked about stuff, and it was just kind of a good conversation at that point in time. And we just kept on talking, stuff like that. And things kind of worked out. It was a very interesting dynamic in the sense that when I came to Bill, I kind of told Bill right from the start that, I've been in practice for about 10 years. If I join you, I don't want to go through this whole rigmarole where I'm an associate for 2 years and I want to then go ahead and decide to buy in or not. I want some type of commitment that we're going to be on the same level very soon, right from the get-go. And it was an interesting exchange where within the first 6 months or a year, I can't remember exactly, but both of us had enough trust in ourselves that I went ahead and gave Bill a whole bunch of money to buy my shares. And Bill had enough faith in me that he said, okay, I'm going to give up a lot of my control at that point in time. And it's been a great journey. I mean, Bill has been a great partner from that perspective. I mean, always treated me fair. And I think we kind of look at things, a lot of it is very similar in terms of how we approach things, but yet there's a lot of things that's very different. And I think we respect each other's view as far as how each of us do it. And it's been a great partnership from that perspective. I mean, I see a lot of situations where you join a practice and you think you know what you're getting into, but then after a few years, things aren't quite the same as you thought it was going to be. And it's not uncommon where people after the first 2 to 3 years, they end up looking for another opportunity or things like that. And it's never quite the same. And I'm just blessed that it's worked out well between all of us. I mean, this is probably year 15 that both of us been together.
So you moved from doing comprehensive ophthalmology, and now, you still do a little bit of that, but
Right.
Mostly you're doing refractive cataract surgery, refractive laser vision correction surgery. What was that transition like?
So I loved it. I mean, for me, I did not realize that such practices even existed where you could go ahead and I'd always wanted to do more refractive surgery and I always wanted to do more cataract surgery. But in my previous situation, I was kind of stuck that I could only spend so much time. I think we live in a model over here where part of it's that you only have so much time. So you have to decide how much are you going to delegate to other people or not. And we live in a practice model where we try to have everyone work to their highest level of their ability. So an optometrist will go ahead and do as much as they can do. We as surgeons kind of try to do mostly in the OR. And it's a model where initially it took a little bit of time because you have to start trusting other people. I was used to doing all of my post-op visits. Now I'm trusting someone else to handle my post-operative care. So it's not something you can take very lightly. It's something that does take some period of adjustment, but I think most of us love being in the OR. We love doing procedures and things of that nature. So it's something that if you have the situation where you've got the right individuals, the right infrastructure set up, and I don't think it's easy to get to that stage, but we've been fortunate that we've got this great setup now where we can go ahead and do the things that we truly enjoy doing.
It truly is an almost one-of-a-kind setup. I think the traditional ophthalmologist is probably, let's say they work in 4.5, 5 days a week. They're probably in clinic 4 days of the week.
Yes.
And maybe they have one half day of surgery a week. And that's, I think, people who are in a good situation. Some have one half day of surgery maybe every 2 weeks or, maybe every 3 weeks. We're in a situation where we have surgery every single day, whether that's doing cataract surgery, doing refractive laser vision correction surgery, and sometimes both in the same day. So it's really just a unique setup where the surgeons are operating most of the time and everyone is really working up to the highest level of their capability. And it really has been a pleasure to be in that environment and just see how efficiently things can be, how exquisite the care can be delivered when everyone is kind of, operating at the highest level.
Yeah, and I think the key thing is ultimately our patients are relying upon us. And we never want the patients to feel like they're not getting proper care. You have to kind of make them understand that we're working as a team. I'm always available if needed, but my team members are someone that can go ahead and give you the great care that you need and get you where to be. And I think it's one of those things that if you are going to do high volume, you ultimately have to create systems in place where you can go ahead and rely upon other individuals and rely upon what their exams are, what their post-operative care is, stuff like that. But always be there if needed. And a lot of it is education. You take it for granted, but education and communication is probably the second big factor, is trying to make sure that everyone kind of understands where we are in this whole spectrum of things.
How long did you feel it took for co-managing optometrists or referring physicians to become comfortable with you, a new provider, a new physician, a new ophthalmologist, transitioning from your first practice to where you are now?
Yeah, so I would say that, what's special about the environment we are in is that we don't really try to push particular doctors, but we more basically advertise or market the system itself. So where we do LASIK is Clear Choice LASIK Eye Center. And when you come to Clear Choice LASIK Eye Center, you won't really see that, do you want surgery by Bafna? Do you want surgery by G, Bafna, Wiley, whatever? But it's more, what day of the week would you like a procedure done? It's assumed that the surgeon themselves are competent and will be good at what they're doing. Now, if a patient comes in with a specific demand that I want to have Bafna or I want to have Wiley or something like that, then obviously we're going to go ahead and respect their demands. But creating that system in place works really well. I would say as far as the external optometry are concerned, obviously when you come in, everyone has been used to Bill Wiley and everyone has to do that. And you have to kind of go around, build relationships. A lot of it's not just being good at what you do, but building those relationships, meeting up with doctors, them seeing your skill set, understanding how you're doing. And I will say for myself, I don't think that I probably could have joined this type of practice right out of my fellowship. I have to be completely looking at myself objectively. I don't think my skill set was there. Probably within 3 to 4 years, I probably would have been there and I could have done that. But it's something that you have to understand who you are and truly look at yourself and try to understand, can I do what's out there? Because it's not, something that's right for every single person. When you get to that point, obviously it works really well. But again, every system is set up differently depending upon where you're practicing. There's no right or wrong. to me, if someone enjoys doing everything, more power to them. I mean, they should love doing that. We just happen to be in a situation where we're much more procedural based. And so that's where we end up spending most of our time.
But we also are involved in a lot of other stuff. So we're very heavily involved in FDA clinical trials, research. We're trying out a lot of new technology, new offerings that have not been stateside approved yet that are available to the rest of our colleagues, around the world. And we're really
We're in the third world.
we're in the third world, right? It's amazing. But we're the ones testing out the technology, seeing what works, what doesn't work, and then helping push that through the approval process. So our patients really get the latest cutting edge technology. Were you doing any of this sort of research clinical trials before you joined this practice?
No, absolutely not. I mean, in fact, in my mind, I always felt like research is something that was pretty much relegated to the academic world, and that in a private practice setting, you would not have that opportunity. So this was fantastic from that perspective. And actually, when I joined the practice over here, we weren't doing any research either. I would say it's only been after about maybe 5 years or so. Bill and I struggled a lot initially in terms of getting our research department off the ground, because when you've never done trials before, the companies will look at you and say, in fact, we actually didn't do much in the way of when I partnered up with Bill, we weren't even doing much speaking as far as industry is concerned. We weren't going to conferences. This was sort of an evolution that took place over time. And initially we started speaking, going to different conferences, things of that nature. But the research was probably the hardest thing, because until you develop a track record, companies are not going to be willing to give you a phase 2 trial. So we kind of work with different people. And I think Kevin Waltz from Indianapolis helped us out quite a bit when talking about, well, you have to hire a full-time research coordinator. Even though we didn't have a trial in place, we went ahead and put forth the investment to try to hire this right person to try to help you through this process. And gradually it's kind of built up where now we are part of lots of trials.
So what was that organic development or evolution like? I mean, did you start with IITs at first? Did you really just kind of wait until you had a research team in place and then a company or some industry firm gave you that opportunity for the first research?
Yeah. So I would say that IITs are something that we didn't do a whole lot of. It seems like it takes a lot of work, and the compensation in general doesn't tend to be as great. So I would say from an organic perspective, the first thing we did was we first looked for a good research coordinator. Now, a lot of people say, well, you can take your best tech that's out there and convert them into a research coordinator. And that can be done, but we basically felt that let's start with getting a formal research coordinator. Not necessarily have to have ophthalmology experience, but just understands the language, understands because everything is very, very much that you have to go by the books. You can't take any chance of that. And then after that, the companies kind of knew who we were, but obviously we've not done any trials. So where they felt comfortable with would be in a phase 4 trial where something's already been approved, but they need to kind of do a certain number of cases with that. So we went ahead and did that. And I think the key thing that any company is looking for when they conduct trials are, number one, they want to make sure you have good outcomes. But number two, they want to make sure that if they select you for a trial, that you will go ahead and enroll a certain number of patients. Because typically you may have 8 to 10 sites, and each site's expected to maybe enroll 20, 25 patients. But if you can consistently be one of the top 2 or 3 enrollers, then all of a sudden you start getting noticed that, hey, this trial does a great job whenever we come. This clinic does a great job with it. So after we did a few phase 4 trials, that's when we got our first phase 3 trial. Of course, once we got that, we basically told ourselves, we're going to kill this. I mean, we told everyone that we're going to over-enroll and just make sure that we really end up the top enroller, do a great job in it. Did great with that. And then once you do good with one company, typically that company will give you another trial. And then over time, other companies start to come in and just slowly start snowballing. And we found our forte tends to be more with IOL trials. Just because we've got a high cataract volume, it's very easy for us to go ahead and recruit patients. And I feel the beauty of research is a couple aspects. Number one, it gives you access to technology that your colleagues on the street don't have access to. So you have the ability to be able to offer something that no one else has inside there. Once you have that, you get a chance to see, well, do you really like it or not? Is it as good as you think it's going to be? So that if and when that product gets approved, you are already on the front end where you kind of know what exactly happens with this product. Because every time something gets approved, it never quite performs exactly the same way as what you think it is. There's always going to be some nuances to it. So because you've been involved with that trial, you already know that, well, this patient does well with it, this patient doesn't do well. So it puts you a step ahead of everyone else that's out there. And you know how to incorporate it into your system and things like that. So I think that's one big aspect of research that's great. The other big aspect is it gives you the opportunity, especially when it comes to cataract surgery, where let's say you have a patient that comes in and would like to have an upgraded lens, but from an economic perspective, they don't have the ability to go ahead and go with that. Well, potentially we may have a trial that he could go ahead and enroll in, and it gives them access to this technology that they may not have. So even though we may upgrade a certain number of patients, but through our research department, there's another subset of patients that we've in a sense upgraded to a higher technology. So I think it's just a win-win for us, for the patients, and for the company as well.
That last point you brought up is something you told me probably just a couple months ago, and that really changed the way I look at research and clinical trials. Because I'm someone, I don't really enjoy doing bench research. I've been through that. I've done that in the past, and yeah, it was very helpful. What I enjoy is clinical research, trying out technologies, really helping to contribute to our field of refractive surgery, refractive cataract surgery, and just sort of push the bar of patient outcomes forward. And you had mentioned that there's other parts of the world, right, where, like India, for example, where some of your friends, they have their private practice clinic where they perform surgery, but then they also almost have a second clinic that's more charitable, charity-based.
Right.
And they're able, and you know, the financial and economics of conducting surgery are very different in the US versus other parts of the world. And you sort of related that being involved in these clinical studies, being able to enroll these patients who maybe otherwise couldn't afford a multifocal lens or an extended depth of focus lens, you can almost still do that charitable surgery for them at no expense to them. And that's kind of, you viewed your way as doing that. And that to me is really powerful and not something I'd ever considered or looked at from that perspective before.
Yeah, no, definitely. I mean, I think I love the fact that we can advance the field, advance technology, things like that. But I think for me, there's definitely some patients that come that we may see that maybe they have 2.5 diopter of astigmatism. And your heart, you know that if I could put a toric lens in there, they're going to be seeing so much better than if they're done. And unfortunately, they may not have the means to pay for a toric lens. So then the situation is, well, do I just go ahead and put in a basic lens and then they just get the astigmatism afterwards? Or can I get them into a trial? And now they've got that opportunity of getting that toric lens. So that's where I see that there's a benefit for our patients as well, for those patients that can't afford that.
And the amazing thing about these IOL trials is most people, when they think about medical research, they think, oh, someone's going to be taking blood from me. They're going to be running these unknown tests. Who knows where that information is going to go? But for these trials, the surgery is the exact same as a surgery otherwise would be. Really, the only obligation on the patient's part is to show up for an extra few follow-up visits, just so we can essentially provide more care to them, do more eye exams, make sure everything is really, really the way we want it to be. And so it's really a low barrier to entry, I think, for the patients.
I think the other big advantage we have here, sitting here in the US, is a lot of the lenses that we're using are not lenses that are unfamiliar to us. We live in a global society, and many times we already know that there's certain lenses that are available in Europe that we don't have over here. So when a company comes to us and says, hey, we've got this particular lens that is not available in the US, like, for example, EVO and the ICL. I mean, we've been dying for EVO for the last 10, 15 years in the US. And so when the opportunity came to do that trial in the US, from my perspective, when I'm talking to a patient, I can look them in the face and tell them that this is a research trial, but the reality is that, as far as I'm concerned, this should be the lens you should be using right here. I mean, there's nothing experimental about this lens. This lens has been tried in hundreds of thousands of patients. They do extremely well with this lens. And the beauty about this for you in the US is you're getting the opportunity of getting this lens at no extra cost to you. So because we're always a little bit behind compared to the rest of the world, it's something that becomes much easier to convince patients that to be part. Because normally when you hear the word research or trial, the patient's, the first instinct is, well, I don't want to be a guinea pig. I mean, this is my first set of eyes, my only set of eyes. I don't want to take a chance, stuff like that. But when you can let them know that, well, this is really not truly experimental, but something that we have good experience with, becomes much easier from that perspective.
It's so unique, isn't it? I mean, to be able to, the same thing, EVO patients come in and say, oh, I want this experimental ICL. And I say, we have a decade worth of clinical evidence. The rest of the world has already done the clinical trials. We are just finally getting our hands on it now. It's the same way with SMILE.
Right.
You know, patients say, well, SMILE is the new procedure, right? And I say, well, relatively new relative to LASIK. That's maybe been around 25, 30 years. We've been involved with Smile from the very beginning, but Smile's been around even longer than our experience with it just in the rest of the world.
Correct.
And so we're able to offer these patients the latest cutting edge technology, the best sort of precision and refractive outcomes at no cost to them. And there's very little risk involved. I mean, almost no risk beyond just the normal risks of having any eye surgery done. Now, tell me what it was like going from never speaking at the podium to all of a sudden now getting involved, because you're someone who is engaged. There's some people I think who probably graduate residency and then they never go to another conference again, or they never open like a trade journal or read any peer-reviewed literature or never watch videos on YouTube. You're someone who's engaged with the field. You go to these conferences, you go to ASCRS, you go to AO, you go to ACOS, you're presenting at the podium, you're exchanging ideas, you're sharing knowledge. What was that like for someone who had never really done that before?
So I will tell you that I have a very interesting perspective, because to me, my first years in practice, I still would go to conferences, but it was almost like a perk to kind of go out and visit a place and kind of go listen to speakers. And I'd sit there in the audience and listen to these very speakers, and I would think to myself, boy, these are like gods over here. I mean, look at the knowledge that they're imparting to us, things like that. I was like amazed at what they're doing. And so now I'm part of this practice, Cleveland Eye Clinic, and now I'm the one that's actually on the podium and presenting. And I'm thinking like I'm no different than anyone else out there. Like, there's nothing special. I mean, I'm giving them information here, but I started realizing that anyone, if they have a passion and can do something, has the ability to go ahead and lecture and speak on it. I mean, I love teaching, if at all possible, and then go ahead and make slides, go and make presentations. So I felt very comfortable as far as making a presentation, things like that. I think it was just a difference in mindset in terms of, I know the first few times when people would ask me to speak, I was like, sure, you want to talk to me? I mean, like I was like, I'm just a regular ophthalmologist here. I don't know if I'm giving anything special. And I mean, so that was the one thing that was different for me, is I was like, I didn't know that I really belonged. But you will realize that most people that are speaking love to have new people on the podium, want to encourage people to come up there. And you almost get like a society of friends that basically love to interact with one another. And you get this new subset of individuals where now when you go to conferences, it's not just a question of attending the conference, but it's like, okay, I got to go from one lecture to another lecture. In between, I'll get to meet up with my friends who are in different parts of the country. You get to go, and the best part is it's a resource that you can go to, that whenever you have a question about some complicated case, you don't have to feel like you're isolated, but you've got a few individuals you can just go up and give them a phone call and say, hey, what would you do here? What would you do there? And I think that's the best part about being in that situation.
Yeah, being engaged with the field, especially for me from a very early stage, has been so amazing and so beneficial, because I feel like I found my ophthalmology family by going to meetings, by going to conferences. It wasn't in residency. I had a hard time relating sometimes to some of my co-residents who either weren't interested in going to conferences or weren't interested in doing research or not really interested in refractive surgery, the sort of stuff that we're involved with. But it was when I would travel to New Orleans or travel to San Diego or travel to Florida, and I would meet these like-minded individuals, and sometimes only for like an hour at a time. And then maybe I'd see them again 4 months later at a different conference. And then over years, you develop these relationships. You see these same similar faces over and over again, and you realize, hey, we're pretty similar. We're pretty alike. Right. And then you start talking or giving lectures or presenting your research, and people are passionate about the same things you are. And now all of a sudden, you've built this network around the country of people, like you said, that you can turn to if you have a difficult case. And so now there's not a day that goes by where I'm not texting some group of friends and someone posts a case. Hey, I've got this patient who has, this irregular looking cornea, or like, what would you do in this situation? And then all of a sudden you get these 10 expert opinions coming back over the course of 24 hours. And it's just a resource that you otherwise wouldn't have access to. It's really amazing.
And you're actually, Arjun, I mean, you're fantastic from that perspective, in the sense that you're just completing your fellowship. And I see how much you've already done in that period of time. I mean, it's incredible where you're at this stage in your career. So kudos to you what you've been able to achieve so far.
Thanks. I appreciate that. So you experienced LASIK. You had the gift of refractive surgery per se. Refractive surgery, there's a very different level of pressure relative to normal ophthalmic surgery. I mean, any ophthalmic surgery is high stakes. Like we talked about, you have patients' vision in their hands. But refractive surgery, you're often, unless you're really looking at eyes that have high refractive errors, being eyes with pathology, a lot of times you're taking eyes that can see 20/20 or even better with glasses or contacts. And you're performing surgery on them to not prevent loss of function, to achieve gain of function. So you're taking healthy eyes and doing surgery on them. And there's a lot of people who would say, a lot of people who aren't into refractive surgery would say, why would you ever do that? That's crazy. And you see the impact you can have on the quality of life of these patients. What was that like, transitioning from comprehensive ophthalmology to refractive surgery? It's a very different pressure.
Yeah, it is a different pressure, but I think what you have to start taking into perspective is, you mentioned the word normalize, and the question is, what is normal eyes? And again, I think to a lot of our colleagues who are non-refractive surgeons, they would say that these are all normal eyes. But the reality is, from my perspective, is that you're depending upon some other ancillary thing, like whether it be glasses, contact lenses, something to go ahead and try to get you so that you can have this good vision. So I don't view it as cosmetic surgery, because in cosmetic surgery, you're changing the appearance of how something looks. Whereas in refractive surgery, you're changing how well the eye functions. I mean, you're actually improving the functionality of the eye itself. So I think when you look at it from that perspective, I mean, it is not really working on a normal eye, but it's taking an eye that has some level of dysfunction that you're trying to improve the functionality of. That being said, you are absolutely correct that the stakes are much higher, in the sense that I'm taking someone that may have relatively good vision, and everyone's got a different threshold as far as what they feel comfortable with. I mean, I'm now at a point in time where someone may have a minus a half diopter sphere, and I feel very comfortable that depending upon the metrics and how they feel, I could go ahead and, in fact, that's sort of where my wife was at. I did LASIK on her eyes, and she loves the fact that her vision is. So a lot of times it's all relative, in the sense that you only know what you see. You don't know what you potentially could get to. And if you can get to that point, and the beauty of refractive surgery is that we're now at a stage where we can potentially deliver vision that may potentially be better than what their patient was used to, even with their glasses or contact lenses. I know presbyopia is still a big area that we're still working towards inside there. But as far as myopia, hyperopia, things like that, I mean, technology is great right now, and it's just continuing to evolve and keep on improving and getting better inside there.
You brought up a point, I think, that is relevant to not just refractive surgery, but the rest of ophthalmology and probably life in general, which is you don't know what you don't know. And if all you've ever done is surgery in a certain way, and you've only seen your outcomes, and that's, you kind of live in your own little bubble and you keep doing things that way, you're never going to know what your potential could be. And so if you don't visit other practices, you don't watch other surgeons, you don't go to these conferences, if you don't learn and keep expanding your horizons, you're never going to grow as a surgeon, you're never going to grow as a person. And I think a lot of times people are very dogmatic in ophthalmology, probably in medicine in general. It can only be done this way. This is the way it's done because these are the outcomes I've seen. But if you don't try and learn and constantly question your level of methodology to see how can I make things better, you live in a very closed system. And ophthalmology is a field that is evolving so rapidly. I mean, I look at the IOLs that were out when I was in residency and thinking, wow, this is the latest stuff. I mean, we don't put those IOLs in anymore.
Right.
And the IOLs we're putting in today, we're not going to be putting in 5, 6, 7 years. I tell patients it's like the tech industry. You say you want the latest and greatest laptop, you want the best smartphone. Well, you can have that, but 2 or 3, 4 years from now, something much better is going to be out there.
Correct. No, absolutely. It's going to keep on evolving, keep on changing. And so you have to be willing to, I love the idea of, I try if possible to make it a point to go visit a practice. Because you're right. I mean, there's many different ways of approaching things, and whether it's how you run a practice, it's how you do a procedure, things of that nature. I think it's important to take some time out to go ahead and visit other things of that nature. Because if you remain dogmatic and aren't willing to change, it is very static, and you need to be open enough to realize that there are many different ways of looking at things. Doesn't necessarily mean you're going to adopt everything that you see, but I think that's probably one of the best things you can do is just visiting other surgeons in the OR and just observing.
Right.
And just kind of keeping an open mind.
So the evolution of things and running a practice, you joined Bill and you guys have worked together 10, 15 years now. You helped him really build Cleveland Eye Clinic, Clear Choice Custom LASIK Center into what it is. But then you guys had another evolution that took place just a few years ago, right before the pandemic, which was the merger with private equity.
Right.
What was that discussion like before that happened, and what ultimately led to making that decision?
Sure. So it's anytime you look at change, it's something that is very difficult. It's very challenging. You never know what to expect, things like that. And I think we've always continued to keep on expanding. And I think pre-private equity, one of the discussions Bill and I had was just kind of looking out at the future, trying to determine what is the best way that we can continue to keep growing? Because in our minds, if you remain static, that's basically the start of working downwards. I mean, you got to keep on working. How do you keep on growing, improving, things like that? So in our minds, we basically were trying to see what is the best way where we can continue to keep growing, expanding the whole market per se. And the two choices we were presented, I mean, we basically had three choices. One is continue to do it organically, which is what we've been doing for a period of time. The challenge with that is obviously between Bill and I mean, there's only a certain amount of capital that we have. So we're sort of limited as far as what we could potentially do. And a certain amount of time that we have. Time is, we're very busy surgeons, so we don't have that much extra time inside them. Second thing is looking at hospital systems in the area. And over here, we did not feel that that really would be a way that we could potentially keep on growing. Or PE, private equity, was another methodology that we said that we can potentially grow. Now, many people view PE as an exit strategy or a way that you can maybe get some windfall of money and kind of move on. But our view of PE was, which methodology did we feel we would be most successful in terms of being able to continue to grow things and things of that nature? And when we eventually partnered up with PE, and again, I want to make a clear distinction here, is that I typically will not use the word that we sold to PE. I love saying the word that we partnered up with PE. I view our PE partner as one that has helped us to grow, continue to evolve, things like that. And I will say that everyone's PE journey is very, very unique and very, very different. I think people on the outside that may have not been involved in PE may think that PE equals PE. And what I've realized having gone through the process is that it can vary so much depending upon who your potential partner is. When Bill and I started exploring this, we basically had like maybe 20 different offers from individuals that wanted to go ahead and work with us. And what you realize when you go down and sit with all these individuals is what ends up happening can be very, very different. I mean, you can be in a situation where they completely take over, your style of practice changes, things of that nature. From our standpoint, we felt that we were still relatively young. We wanted to keep on growing. So we wanted to be in a situation where we may not necessarily take the most amount of money that was being offered, but we want to make sure whoever our partner was one that would continue to give us the autonomy to continue to grow and evolve the way we'd like to. So we're fortunate to join up with Midwest Vision Partners, which is backed by Alpine, back in December of 2019. And I think the thing that we gravitated towards that is that we felt that they as a group would be someone that would let us continue to practice the way we wanted to practice. And a lot of people come back to us and ask us, so what changed after you partnered up with PE? And the best answer I have, which I can honestly tell them, is I felt like nothing changed. I mean, Bill and I continue to do what we're doing in the sense that another type of PE partner may have come back and looked at us and say, hey, we want you to cut back in how many conferences you attend, because when you go to conferences, you're taking time away from clinic. That's time when you could be productive and things like that. The individual that we've chosen with MVP, they encourage us to continue to present. They encourage us to continue to do research. We still have the same amount of, they want us to practice the way we were practicing before. So the amount of time off before we're still taking the same type of time off as before. And overall, I think it's been phenomenal for us. We've continued to keep growing and continue to keep evolving from that standpoint. But that was a big change that took place. But looking back, I can tell you that going through it was one of the best decisions we ever made.
What was that time frame like, vetting, from when you guys decided, okay, we're probably going to be partnering with private equity? You have these 20 offers. How long did you look at things? What was that vetting process like?
So that process takes almost close to a year. Because you start thinking about it, you may go ahead and bring on an investment banker, and then that banker will go ahead and try to work towards getting all your numbers in place. So it takes a lot of work to do that. Then you may go ahead and have these offers that come through. You have to go through those offers. Then you have management presentation where they come down. You have to have different dinners. We had met with 10 different groups, kind of sit down, discuss, and you got to figure out, well, which ones we want to go down. So they narrowed it down to 3 potential individuals, have future meetings with them. So it's a long time, arduous process, but I will say it's extremely critical that you go through that process, because it's only then do you realize, because when you go through it for the first time, and all of us will maybe only do it once, you don't realize how many aspects there are to this whole thing. But that's I think that the only reason why we're as happy as we are at this stage is because we did take our time to go through it. It's not something that you can rush through at all.
The past 3, 4, 5 years, we have seen an explosion of private equity in ophthalmology, and we're seeing it in other areas of medicine as well. I think dermatology and emergency medicine are seeing this dynamic take place as well. From my understanding, there was a similar dynamic, was it back in the 80s, early 90s, with it wasn't quite private equity, it was called something else, but a similar sort of concept. And then that ultimately kind of failed and fizzled out. Do you see private equity continuing to grow? Where do you see things headed?
Yeah, I think what happened back in the 80s is very different than what's happening over here at PE, in the sense that there they really didn't give actual cash. They basically give stock options, things like that could potentially go down to zero. Here, there's actual equity. And the PE model, not just in ophthalmology, but if you understand PE, my son-in-law is in PE and my son is in investment banking. And when you look at it, not just from a medical perspective, but look at it from an overall industry perspective, you get a better, clearer understanding of how PE works in terms of trying to augment things and trying to improve upon things. So I don't think this is a short-term thing. I kind of view this as a long-term perspective. I don't view that all practice will be part of PE at some point in time. I think there will be a subset of patients, subset of practice that are part of PE. And in my mind, I mean, I think you've lived it yourself when this past year is, I really don't feel like being part of PE has really changed who we are or what we practice, things like that. We're still kind of doing the same thing. But I will say that it's very different from one person to another person as far as which practice you're with in that side of things.
I've seen multiple practices undergo that PE merger. In the sentiment, and maybe I'm just, my end is people who've had good positive experiences. The surgeons, the physicians tend to feel like not a whole lot has changed. And maybe with the backing of extra capital, they're able to maybe acquire more equipment, more technology, offer new procedures. But some of the sort of micro changes that maybe aren't as positive, I feel like I see in like the technicians or the staff. And a lot of that has to do with payroll and how things are, all that stuff. So even though maybe we as surgeons are not affected by that realistically, like as heavily as some of the other people, there are those sort of changes in the system that are still shifting and taking place.
And I think you are right. I mean, there are definitely changes that do take place inside there. So I can't be blind towards that. There's definitely change inside there. I think one concept that a lot of people have is that PE comes in and a lot of people are basically fired. You're kind of reducing payroll, things of that nature. And I know in our experience, we've actually kept everyone that we had. We've actually increased the number of people that we had before. Now, change is one of those things that is sort of ongoing per se. And I think one of the toughest parts that we've had in the last 2 or 3 years is having COVID and the pandemic has created changes throughout the entire HR spectrum in general. If you look at most industries, all industries, I mean, are short in numbers of people and staff and things like that. I mean, it's been a very challenging time frame from a workforce perspective. So, but I mean, you are right that there will be some degree of change inside there. And I think you just have to look at the overall perspective in terms of, I, for one, feel like had I been the one that was completely on my own during COVID-19, I question whether we would have been as effective in terms of leading our practice through this difficulty as our being partnered up with PE.
Yeah, I mean, you guys kind of emerged stronger than ever, which it was interesting seeing when the pandemic first hit, how different practice environments, whether that was academics, small group private practice, large group private practice, multi-specialty group, or private equity-backed practice, how they all responded. And academics probably lagged the most in terms of when are we going to start doing elective surgery again,
Right.
and getting patients back into clinic. And it seemed to be the multi-specialty groups or the private equity-backed groups that opened their doors back. Maybe they had 4 to 6 to 8 weeks off, but then very quickly they were able to get back into things, implement certain processes to make sure that we're taking appropriate precautions to prevent spread of COVID, make sure everything is still sanitary and hygienic. And that was, I think, very practice and context situationally dependent. You've relayed, in the course of us sitting here, a lot of changes that you've witnessed and experienced and lived throughout your career, throughout your life in ophthalmology. What is inspiring you? What are the changes on the horizon? What are the things you want to be doing next to keep growing and becoming better?
I think for me, a lot of it just comes down to I want to try to start giving back as much as possible. So I've been very fortunate in life where we've been able to do a lot of things that we've been able to do. But I think this is now, I feel like I'm getting into a phase where I'm trying to look for opportunities where I can potentially give back. Obviously, in our clinic, we've got situations where through, can't remember which foundation it is, but we can go ahead and offer charitable surgeries, things like that. But
Operation site
operation
through
site,
Ascris,
exactly,
right?
yeah, through
Right.
ASCRS. But even when I go on trips, part of it is I'd like to have certain trips set up where we basically go ahead and offer free cataracts. I mean, it's a privilege to be able to offer surgery. I think it's something that that would be probably the next phase for me.
Yeah. Well, Shamik, it's been an absolute pleasure. I know you got a busy social schedule ahead of you, so I want to be respectful of your time and not keep you here. But thanks so much. It was a great conversation.
Oh, thank you. This was awesome.
Yeah.
Thank you, Arjun.
Yeah. Awesome.